Hello, my name is Lyle Christensen and I am one of the athletic trainers with Mosaic. I'm here today to talk about some preventative things with heat illness. One of the first things you need to do when you're looking at doing activity or games or practices outside is you need to look at the weather, see what the weather's doing. You know, where's the temperature at, where's the humidity at, and on the website here later on I will have AMESHA guidelines that we follow, both the middle school and the high schools are supposed to follow as far as the temperature. And again, that will be listed on our web page there. But that's the first thing when you're looking at that is what the weather, what the humidity is. Obviously, if it's extremely hot and on those guidelines, then you need to either A, cancel that activity or curtail that activity, limit the time. Another factor there too is to make sure both kids and adults, they're hydrated, making sure you're getting enough water in you. And one way to check to make sure, and this sounds kind of gross, but you need to check your urine. If your urine's darker than normal, then you're probably dehydrated and you really need to push the fluids. If your urine is clear, then you're okay. You're good to go. But you need to make sure that you're hydrated and get that water in you, either water, Gatorade, Body Armor, something along that line. Try to avoid the alcohol and the caffeine there. Another factor here too is if you notice someone, you're keeping an eye on people, and you notice that they're getting hot, they're not sweating, they just don't look good. You need to pull them out of activity and get them into a cool, refreshing area and make sure they're hydrating. So that so you don't eventually have some problems there. Another factor here too is if you notice someone that's having some muscle cramps, they just don't look good, they're getting sick, they're nauseated, they're complaining of headaches, they're just not acting themselves. They're in the early signs of having heat exhaustion or a possible heat stroke. If you notice these people, again, you need to pull these people out, get them in a nice cool area. If you've got access to a cold tub or a tank, you probably need to get these people in there to get their body temperature down. Another factor too that we use as athletic trainers here within the state of Missouri is what's in my hand is a guide here to tell us whether or not it's a wet bowl, tell us what the relative humidity and the heat combined in there. And if, again, this is on our website where these numbers are at, to kind of give us a guideline of what they should be doing, what they shouldn't be doing. If it's too hot, then obviously we need to limit their activity or possibly cancel and wait till a later time in the day to get them cooled.